As we approach the holiday season, a looming question hangs in the air: will there be a lockdown on the horizon? Recent data paints a complex picture. According to the World Health Organization's weekly epidemiological update, the last 28 days saw over 1.4 million new COVID-19 cases and over 1,800 deaths reported globally. While this marks a 38% increase in cases, there's a notable 50% decrease in deaths compared to the previous month. In late August, up to 10,000 people per week were being hospitalized with COVID-19. Although a significant number, it's considerably lower than last year's peak of 40,000 weekly hospitalizations. More details are in the report.
In a world still grappling with the ongoing challenges of the COVID-19 pandemic, we find ourselves on the cusp of the fourth virus season since the coronavirus first arrived on the scene. As we navigate this evolving situation, here's a snapshot of the latest updates and expert advice to keep you informed and safe. According to the weekly epidemiological update on COVID-19 by the World Health Organization, the last 28-day period from July 31st to August 27, 2023, saw over 1.4 million new COVID-19 cases and over 1,800 deaths reported globally to WHO. These numbers represent a 38% increase in cases and a 50% decrease in deaths compared to the previous 28 days. In the United States, data from the Centers for Disease Control and Prevention, CDC, for August revealed a concerning trend. COVID-19 hospitalizations surged by nearly 19% in a single week, with deaths rising by more than 21%. Between August 13th and 19th, over 15,000 hospitalizations and 636 deaths were reported. Infection rates have been on the rise in states like New York, Florida, California, and Massachusetts, prompting concerns about the upcoming fall season. The CDC anticipates a further increase in cases and is preparing for the release of a new booster in the coming weeks. Both Moderna and Pfizer are diligently working on updated COVID-19 vaccines targeting the emerging XBB strains and subvariants of the Omicron variant. Pfizer has projected approval for its new shot by November, with vaccines expected to be available in late September or early October. Experts strongly advise individuals over the age of 65 or those with weakened immune systems, particularly those lacking recent immunity to COVID-19, not to delay getting an updated COVID-19 shot. The current bivalent booster offers essential protection. However, those who opt for the existing booster may need to wait weeks or even months before receiving the updated version set for release in the fall. Now, a pressing question lingers in the air: will there be a lockdown during this holiday season? CDC Director Mandy Cohen reported that in the later weeks of August, up to 10,000 people a week were being hospitalized with COVID-19. This number, though still substantial, is significantly lower than the peak of 40,000 weekly hospitalizations witnessed last August. The risk remains especially high for unvaccinated individuals, those who have not previously contracted the virus, and older individuals with underlying health conditions. Approximately 70% of hospitalizations occur among those aged 65 and older. Adding to the complexity, in mid-August, the CDC announced the detection of a new SARS-CoV-2 variant known as BA.2.86. This variant has multiple genetic differences from previous versions of the virus and is currently responsible for less than 1% of COVID cases in the USA. It boasts 35 spike protein mutations, a significant departure from the currently circulating variants. The spike protein is the virus's key to entering our cells. These mutations raise concerns about their potential to evade protection provided by COVID vaccinations and prior infections. Experts, including Caitlin Jetelina, an epidemiologist and scientific consultant to the CDC, are closely examining this new variant's behavior. The CDC believes that BA.2.86 may pose a greater risk of infection to individuals who have previously had COVID-19 or have been vaccinated due to its spike protein mutations. The effectiveness of the new booster, expected to be approved by mid-September, is under evaluation. Meanwhile, public health officials are monitoring two new variants, the Omicron variant E.G.5, nicknamed Iris, which has become dominant in the US, and the emerging BA.2.86. In response to positive COVID-19 cases among students, some schools have reinstated mask mandates and restricted public gatherings. Hospital systems in New York State have also taken similar precautions. As the world faces the evolving challenges of COVID-19, staying informed and following expert guidance is crucial. We must all continue to adapt and prioritize our health and safety as we navigate the fourth virus season.
Thank you for watching our videos. If you enjoyed the content, let us know by giving it a thumbs up and sharing it with your friends. We value your feedback and ideas. Leave your thoughts in the comments section below, and we'll be delighted to engage with you. Don't miss out on our future content. Hit that subscribe button and turn on the notification bell to stay updated with all our latest uploads. Remember, the quest for knowledge and exploration never ends. Keep learning, keep exploring, and keep expanding your horizons.